Hi everyone, my name is Sam Gardner, and for years I suffered in pain with tingling and burning sensations in my arms, wrists, and hands. As I'm sure you know, this is known as a repetitive strain injury or RSI. It's also called an overuse injury or a musculoskeletal disorder. And there are many conditions that fall under this label. There are too many to cover them all, but the main ones include carpal tunnel syndrome, tendinitis, and peripheral neuropathy. After more than 2 years of research and trial and error, and after talking to dozens of people like you who have suffered in pain for months or even years, I finally managed to understand what lied at the root cause of my problem. And once I did that, I was able to permanently get rid of my pain within a few weeks. In hindsight, it makes a lot of sense, and sometimes I wonder why it took me so long to figure it out. But anyway, I've been 100% pain-free since September 2019, and I'm here to show you how you can do it too. The best thing is that I didn't need to undertake surgery, take painkillers or special drugs, or pay for expensive therapy or rehabilitation. In fact, the knowledge and principles I'm about to share with you in this video are fairly simple, but I believe they hold the key to your rehabilitation. But you see, because this knowledge and these principles are fairly simple, there's not much money to be made with sharing them. Healthcare is a big business, and it's much more lucrative to sell expensive solutions, such as surgery, drugs, and wrist braces. These things unfortunately do little to address the root cause of the problem. And as a result, there are hundreds of thousands of people, if not millions, who continue to suffer from RSI every year despite having tried almost everything they can get their hands on. So I assume that just like me, you want a permanent solution to your pain, not just a temporary band-aid. So my goal with this short video is to share with you my experience and to help you understand how you too can become pain-free. I'm not here to sell you some vitamins, herbal medicine, ergonomic gadgets, or whatever other gimmick might be out there. Now at the end of this video, I will introduce you to a program that I've put together. I call it the Finally Pain-Free program, and in it I teach everything I know about becoming pain-free. It's literally everything I've learned over the past 2 years condensed in 32 short and actionable videos. You don't have to stay until the end of this video though, and you're under no obligation to enroll into this program. But if what I'm about to tell you in the next 30 minutes resonates with you, and if you would like to learn more about the methods I teach in this video and apply them just like I have to become pain-free, then feel free to stay until the end to learn more about the program and what it can do for you. In any case, my goal here is to share with you as much valuable and actionable knowledge as possible within about 30 or so minutes. So without further ado, let's get started. The first thing I'd like to do is make sure that you're the right person for this mini course. If you're not, then you'd better stop watching now. So let me begin by asking you a few simple questions, and this way we'll be able to make sure that what I'm about to teach you is relevant to your needs and can genuinely help you. First, does typing on your keyboard or using a computer mouse hurt? Or maybe it's doing some other kind of activity or repetitive movement, such as playing a musical instrument, writing, playing sports such as golf, or using tools such as a drill or scissors. The exact nature of the activity is actually not very important. What matters is that whenever you're doing a particular type of activity, you feel pain, or you might think that your pain originated from doing this repetitive motion. If you recognize yourself, then this course is most likely for you. Second, are you feeling pain, numbness, or tingling in your hand, wrist, arm, or elbow? Other common symptoms of RSI include sensations of pins and needles or burning sensations. This pain might be on one or both sides of your body, although it's usually on both sides. The pain might come and go. Some of you will also have pain in other places, such as your shoulders or your back, or even as far down as your hips or your feet. Third, have you tried taking regular breaks from work and doing light stretches in the hopes that the problem would go away, but it hasn't? In other words, is your pain chronic, and does it seem like it just won't go away no matter what you do? Maybe you've also tried using an alternative keyboard, a voice recognition software, or other ergonomic gadgets, but in every case, the results have been disappointing and you've only seen temporary relief. Next, are you unable to do the simple things at work or at home that you had once taken for granted? For example, does your pain limit you from doing certain activities or moving in certain ways? Is your pain affecting your ability to work and to be productive? And finally, have you tried several different treatments or approaches for your pain, but you've received only temporary or little to no relief from each? Some of you might even have tried surgery and only received temporary relief. If you've answered no to each and every one of these questions, then you can stop watching, because it means you probably don't have RSI. But if you answered yes to one or more of these questions, then I think this video can help you. I've been through all of this and I know what it's like. My goal is that by the end of this video, you'll know how you can fix your problem so you can stop worrying and, more importantly, stop wasting time and money on stuff that doesn't work. I won't be able to dive too much into the details in the space of 30 minutes, but I'll do my best to cover as much material as possible. All right, let's get into it. So, I'm sure you've heard the term repetitive strain injury or RSI before, and you might already be somewhat familiar with what that is. So I don't want to spend too much time on this, but what you're seeing here is the definition of RSI given by the US Bureau of Labor Statistics, and it's similar to most definitions that you will see out there. The problem with this definition, though, is that it leaves out one of the most important elements of RSI, and it's the duration of the symptoms. You see, with RSI, pain and other symptoms tend to be chronic, meaning that they don't go away on their own like other problems would normally do. For example, if you go to the gym, you lift some weights and you hurt your elbow, this would not be considered RSI. Why? Because after taking some rest, you would most likely fully recover and be back in shape. Not so with RSI. In fact, I recently conducted a survey among a few dozen people like you who suffer from RSI, and the results were very interesting. I asked people, among other things, how long they had had their symptoms for, and the answer, frankly, surprised me. As you can see here, 58% of people responded that they had had their symptoms for more than 2 years, and 26% between 1 to 2 years. This means that for this sample, 84% of people have been suffering from RSI for more than 1 year. That's truly terrible if you think about it, especially because RSI can significantly affect your quality of life and even your ability to work. I myself suffered from RSI for well over 2 years, and at some point it got so bad that I thought I'd have to change careers. So this got me thinking, why is it that we just can't seem to cure this thing? Why is it so complicated? In the past couple of decades, we've made some amazing advances in medicine, and yet doctors can't seem to be able to address RSI effectively. It's a bit strange if you think about it. Anyway, if you're like me, you probably tried dozens of things to try and get rid of your pain in the hope that something would work. You can see here a list of things that I did over a period of about 30 months to try and get rid of my pain, and this list is not even exhaustive. In the end, after trying all of this and more, nothing really worked. So again, it got me thinking, why is it that we just can't seem to cure this thing? Well, the obvious reason is that we don't understand what lies at the root cause of the problem. Or maybe it's just more profitable for the doctors in the pharmaceutical industry to sell solutions that only treat the symptoms. Whatever the case may be, if you understand what causes your pain, you can address this cause and become pain-free. This is pretty straightforward stuff. But why can't most of us do that? Well, through years of research, I've found that almost everyone gets this one thing wrong about RSI. And it's something you absolutely need to understand if you want to permanently get rid of your pain. The thing is, almost all treatments, methods, or gimmicks for treating RSI, including wrist braces, painkillers, hand stretches, ice compresses, ergonomic keyboards, and even surgery, they're based on the assumption that the cause of your pain is located where the site of your pain is. What do I mean by that? Well, for example, if your hand and your wrist hurt, right now you probably think that it's because there's some kind of problem with your hand and your wrist. Where else could the problem be, right? It's a pretty logical thing to assume. And that's what I thought too for about 2 years. And this got me nowhere. As I just told you, I tried dozens of things to get rid of my pain, and none of them worked. And I'm sure you're in the same or a similar situation, so clearly this tells us that we must be wrong about something. This is really important, so let me repeat this again. The cause of your pain is not where the site of your pain is, If you truly want to solve your pain problem, you'll have to look elsewhere. It sounds so simple, right? But it throws everyone off, including trained medical professionals. And this is one of the reasons why millions of people have seen their lives ruined because of carpal tunnel syndrome and other similar pain problems that just won't go away no matter what you do. So you have to remember that a symptom does not cause chronic pain such as RSI. A symptom is a signpost or a fingerprint. It's an indicator of a problem, not the problem itself. And if you're like me, you want a cure for your RSI, not just a treatment, right? And to cure your RSI, it's just a matter of focusing on the few factors that have been proven to permanently address the cause of your problem. Now, before we go further and look at what exactly can help you get rid of your pain, here's another key point that I need you to understand. It's important to differentiate between what might cause your pain on the one hand and what might trigger and sustain it on the other. The point is that something that might trigger or sustain your pain is not necessarily the same thing that causes it. And unless you deal with all possible contributing factors, your pain is likely to linger for longer than it should. This is another simple thing that throws a lot of people off, and it's a lesson I learned the hard way. Are you following me until now? If not, please rewind this video because these are key foundational concepts that you need to understand if you want to get rid of your RSI. So the good news is that RSI can be treated. In fact, RSI is not a disease or a genetic disorder. It's simply pain in your muscles, nerves, or tendons. But in order to treat this pain, you need to understand and address the root cause of the problem as well as factors that sustain the pain. Thankfully, you won't need to undergo surgery, take painkillers, or pay for expensive therapy to achieve this. Now, before I discuss what exactly it might be the cause of your pain, let me make 3 quick but important points. First, your pain will not go away by itself. Right now, you might be thinking that, hey, things will get better with time, right? After all, most injuries heal naturally over time. And that's true, but it's not the case for RSI. Unfortunately, that's not how things work with pain such as carpal tunnel syndrome. Again, unless you understand the cause of your pain and you act accordingly, your pain is not likely to get better, and it might even get worse over time, like it did for me. Second, no amount of rest and inactivity is going to help. You might think that taking some time off from work will make things better, and it might, but it's going to be temporary. The problem is that as soon as you restart doing the activity that's associated with your pain, such as typing on a keyboard, your pain is going to reappear very soon. Third, pills, ergonomic gadgets, or even surgery are not likely to solve your problem. The reason is because these things don't address the root cause of your problem. Plus, surgery can be very expensive or involve long wait times, and it's not without risks. It also involves a long rehabilitation process. For me, surgery was out of the question. But even if you had surgery before and you still feel pain, what I'm about to teach you can be of great help. But frankly, the worst thing is that most doctors are clueless about what lies at the root cause of your pain. Doctors might be well-intentioned, but in the end, they're trained to treat the symptoms rather than the cause of most health problems. And this applies to RSI too. All right, with this out of the way, let's now turn our attention to the meat of this discussion. We will go over what exactly causes, triggers, or sustains your RSI. Some of this actually takes quite a bit of time to fully explain, but I'll do my best to cover the key ideas in this video. In a nutshell, there are 2 credible and clinically tested methods or theories related to the root cause of RSI. One asserts that the cause is structural or physical in nature, and the other theory asserts that it's non-structural. We'll come back to that latter category in a moment, but first, let's go over the structural explanation. I've put together the chart you see here, which shows a number of structural factors that have been argued to cause, trigger, and sustain RSI. By the way, most of this information comes from the medical literature, but I've also gathered some of this information through interviews, surveys, and from reading about people's experience with RSI. I don't agree with all of what's in here, but I'm including this so that you're aware that there's not just one, but multiple factors that have been argued to contribute to RSI. In any case, you can see that there are essentially 2 structural causes of RSI that are commonly put forth. The first is repetitive motion combined with poor ergonomics, and the second is weak posture muscles, postural imbalances, and skeletal misalignment. Now, I know that this second factor includes three different things, but they're actually related, so we can just count them as one. Now, repetitive motion and poor ergonomics are also known to trigger and sustain RSI. And for carpal tunnel syndrome, an additional trigger is a compressed or pinched nerve. If this thing happens at all, and I have reason to doubt that it does based on the latest medical research, it's not a cause, but a result of a deeper problem. It's what might initially trigger your pain or sustain it, but it's not what causes it. In terms of the factors that can sustain your pain, they're more diverse. They include tight or stiff muscles, trigger points, nutritional deficiencies, hormonal changes such as menopause, inactivity, poor sleep, poor hydration, and a cold environment. That's a lot of stuff, right? So I hope you're not too confused yet. Let's come back to the structural cause of the problem here for a second. Many of you might think that you have pain because of some type of repetitive motion. In other words, you move a specific muscle too much. Maybe you've been using a computer for several hours every day and you think that this is what has been causing your pain. If this is what you think, the natural solution would be to take a break, maybe even a few days off from work, and then recover, right? But as we've already seen, RSI is a chronic problem. It doesn't seem to go away just by taking some rest or by improving your ergonomics. What's interesting here is that there is no scientific evidence that our joints have a set finite capacity for movement. None. In fact, the term repetitive motion injury is in itself quite controversial because it implies that we hurt ourselves by moving a joint too many times in succession. But this is impossible because simple muscle fatigue sets in long before a healthy joint mechanism is damaged. If you think about it, the joints of your body were designed to move repetitively, so we can safely ignore the theory that repetitive motion is the cause of your pain. I know this probably goes against what you've read or what you've been told to date, and that's the point. If the solution wasn't somewhat counterintuitive, you or your doctor would have already found the problem and you wouldn't be suffering in pain like you are now. The key point that you should remember is that experts have shown that postural imbalances and skeletal misalignment typically precede the onset of pain that's attributed to RSI. So it's not about repetitive motion, it's really about postural imbalance and skeletal misalignment. This was another aha moment for me when I first came across this idea in the literature. And the reason is because I knew that I had postural imbalances. For years, I was aware that my right shoulder was lower than my left shoulder, and I knew that I didn't have very good posture, including weak shoulder and back muscles. If you take a look at this picture, which I took just before starting doing a set of specific postural therapy and strength training exercises, you can see that there's a noticeable imbalance in my shoulders. Here's the same picture, but with some red lines drawn to make it easier for you to see the imbalance. My right shoulder and elbow are clearly out of whack here. Here's another picture 2 months after I started a specific set of postural therapy and strength training exercises designed to address this imbalance. You can see there's already a clear improvement. My shoulders are now much more balanced. At this point, I had already been able to reduce pain in my arms and hands by about 90%. And yet, here's yet another picture 2 more months later. At this point, my shoulders look almost completely balanced. Now, your situation might be different, but if you suspect you have a postural imbalance, it's very important that you address it. There are specific steps that you can follow to do this. For example, doing strength training exercises 3 or 4 times a week can be very helpful. In the Finally Pain-Free program, I cover these exercises in detail and I go over a specific step-by-step program that you can follow. So we've quickly covered the structural factors that can cause or sustain your RSI. As I told you though, there's not one, but 2 credible and clinically tested methods or theories related to the root cause of RSI. We've discussed the structural theory, but there's another important one which asserts that the cause of RSI is non-structural in nature. What this means is that your pain can originate from your central nervous system, in which case simply doing exercises or taking rest will not help, or at least it will not result in complete and permanent recovery. Now, this is not a subject I can do justice in a few minutes, but it's so important that I want to spend some time talking about it at the risk of simplifying it a little bit too much. In a nutshell, this non-structural theory is supported by what's called mind-body medicine. Maybe you've never heard about this term before, but it's a pretty straightforward concept that refers to the relationship between the mind and the body. Now, I must admit, the first time I came across the term mind-body, I was pretty skeptical. To me, the term sounded like something vaguely fraudulent, like something you'd come across in a dubious, alternative medicine world, or maybe more like some kind of obscure New Age regimen. The term might evoke a similar image to you if you've never heard about it before, but really it's none of this. Now, mind-body simply refers to the relationship of the mind and the body. And mind-body medicine has been practiced by licensed physicians for over 30 years, working with thousands of patients in reputable medical establishments in the United States. This includes the New York University Medical Center, Cornell Medical Center, and George Washington University Medical School, among others. It's not much of a secret that the mind has great power over the body. I mean, physical reactions to emotional states are the stuff of everyday life. Let me give you a few common examples to help make my point. You have a close call on the highway and your heart begins to pound. Or you're getting up to speak in front of a large audience and your mouth becomes completely dry. Or you're about to go on your first date and you have butterflies in the stomach. Or you're about to miss your flight and you begin to sweat profusely. Or yet you find yourself in an embarrassing social situation and you turn red because the blood vessels in your cheeks dilate. I think you'll agree that these examples are not very controversial, aren't they? They are no more mysterious than the relationship of the heart to the circulation of the blood, or that of any other organ to the workings of the human body. Yet another example is the link between chronic stress and health problems, which has been suggested in the medical literature and is widely accepted. In fact, most of the time, when you go to see your doctor for an illness such as recurrent migraines, eczema, stomach aches, or acid reflux, he or she will usually start by asking whether you've been under a lot of stress lately. Most of us have directly experienced most of the situations I've just described. Mind-body medicine simply goes a step further and says that your mind can also cause physical pain, not just a temporary blush or dry mouth. But in this case, stress is usually not the cause. Now, you might be shaking your head and wondering whether what I'm saying is that your pain is imaginary. And this is absolutely not the case. Look, I suffered from RSI for more than 2 years, and I can tell you that my pain was certainly real. No, the point here is that studies have shown that the central nervous system can order a reduction of oxygen and blood flow to a specific part of your body, such as a muscle, nerve, or tendon, and some doctors suggest that this is what causes RSI. This reduction in oxygen and blood flow can actually be measured through sophisticated medical instruments, such as non-invasive oxygen tensiometry. Of course, before diagnosing this cause, mind-body medicine practitioners conduct a careful history and physical examination because they want to rule out any potential issues or serious diseases. But if the results don't indicate any local structural abnormality, the findings usually strongly suggest that the pain originates in your central nervous system. Okay, we've briefly covered another potential cause of your RSI, but what about contributing factors? Well, once again, some contributing factors can be non-structural. Let me give you one key example. Scientific studies have demonstrated that many things can be conditioned, including sensations of pain. In other words, conditioning can be an important factor that contributes to sustaining your RSI pain. Why? Well, because your nervous system can become conditioned to associate a specific activity, such as keyboard use, with RSI pain. For some of you, the activity related to RSI pain might be different. It might include things such as using scissors or doing some type of repetitive movement. The actual activity involved is not important. The point is simply that your brain, and your nervous system more specifically, can become conditioned to associate an activity with pain, even if the activity is not in fact causing pain at all, at least not anymore. This has been shown by scientific studies. So to clarify what I mean by this, let's go through a quick overview of the theory of classical conditioning developed by Ivan Pavlov. Now, you might have heard of Russian psychologist Ivan Pavlov before. Pavlov made conditioning theory famous in the late 1800s. His experiment was simple yet powerful. He would ring a bell, then feed his dogs. After repeating the process several times, he changed his procedure. Instead of ringing, then feeding, he would simply ring the bell. But by that time, of course, the dogs had been conditioned to associate the sound of the bell with eating. so they would start to salivate at the mere sound of the bell, even if there was no food. This theory is called classical conditioning, and it's also known as Pavlovian conditioning. It means you learn through association. Now, hundreds of other studies with animals, humans, and even cells have been conducted that support Pavlov's conditioning theory. And conditioning is most likely the mechanism by which our prehistoric ancestors and even the very first single-celled living beings on the planet learned things. Something that you might not know is that the human immune system and even sensations of pain can also be conditioned. This was first discovered in 1895 by an American researcher called John Nolan Mackenzie. He had a 32-year-old female patient who complained of severe allergic symptoms to flowers during the summer. Roses seemed to cause the most severe attacks, and her symptoms included red, itchy eyes, a blocked nose, sneezing, and even fever. At the patient's request, Dr. Mackenzie performed an operation on the patient's nose to try and get rid of the condition. But for some reason, Dr. Mackenzie didn't believe that her fits were really caused by rose pollen. So he decided to play a trick on her. He hid a fake rose behind a screen in his office, and when the patient returned a few weeks after the operation, she sat in the doctor's office, unaware that there was a rose hiding somewhere, and she reported feeling very well. Dr. Mackenzie examined his patient carefully and noted that she had no symptoms or signs of allergies. Her throat and nose were completely clear. And so once the doctor established that she had been cured, he took the fake rose from its hiding place. When the patient saw the rose, she started sneezing. Over the next couple of minutes, she was itching her nose and eyes, and she began speaking with a hoarse voice. She also said she had trouble breathing. Her right nostril was completely blocked. Dr. Mackenzie eventually told her that the rose was fake, and she didn't believe it until she examined the fake rose herself. And she could see that it was obviously a fake, and by that time she understood that the cause of her reaction was due to conditioning. A few days later, the patient came to visit Dr. Mackenzie again, and at that point she happily buried her nostrils in a large, fragrant bunch of real roses without experiencing any symptoms at all. In other words, by then she had understood that she had been cured and that her residual symptoms were simply a result of conditioning. And she had been able to break that conditioning by first recognizing its existence and by making a conscious effort not to associate anymore her allergic reactions with roses or other flowers. So the patient's reaction to the fake rose was what is called a conditioned response. How is that possible, you ask? Well, put simply, her body learned to react when she saw what she thought was a rose. She had somehow been conditioned to launch an allergic reaction or an immune system reaction to roses and other flowers, just as Pavlov's dogs were conditioned to salivate when they heard a bell. And Dr. Mackenzie's story was revolutionary because it showed that the immune system could be conditioned. Later, several human and animal studies replicated Dr. Mackenzie's findings. But how is this relevant to RSI? Well, it turns out that it's not just our immune system that can be conditioned. An Italian doctor and researcher named Luana Colloca conducted a study in 2008 that showed that pain sensations can be conditioned too. Here's how she did it. Colloca gathered 46 healthy volunteers. Each volunteer got either one conditioning session or 4 of them. The sessions involved 3 kinds of flashing lights, followed by small electric shocks. First, a flashing green light followed by a mild, non-painful electric shock. The second was a flashing yellow light with a lightly painful shock. And third, a flashing red light and a painful shock. After the participants had been conditioned to associate the different colors with a lack of pain, mild pain, or pain, Colloca secretly switched things around without telling any of the participants. This way, participants ended up receiving mild shocks only, no matter the color of the flashing light. You'll remember that up until then, mild shocks had only taken place with the yellow light, but this time it took place following flashing lights of all 3 colors. What's interesting is the patients didn't feel that way. In fact, after a red light flashed, they felt a painful shock. This is because they had been conditioned to associate a red light with a painful shock and a green light with a mild shock. This study is important because if you've been suffering from RSI pain for many months or even years, it means that you too will have been conditioned to associate pain with a particular activity. There's simply no way around it. In fact, the longer you've suffered from your condition, the stronger the conditioning effect would be. For many of you, this activity might be typing on a keyboard, but whatever the specific activity involved, the point is that your body has likely become conditioned to feel pain in response to specific environmental stimuli. So how can you break this conditioning, you ask? Well, first, it's important to recognize that conditioning exists and may be responsible for sustaining your symptoms. But it's also important to stop associating pain with a particular activity, such as typing on a keyboard. That's why one of the steps we discuss in the third module of the Finally Pain-Free program involves discarding your physical remedies. By stopping your use of a wrist brace or special ergonomic gadgets and other physical modalities, you can help break the old conditioning that contributes to sustaining your symptoms. As long as your mind associates keyboard use with pain such as tingling or burning sensations, your symptoms will linger for longer than they otherwise should. Alright, we've covered quite a lot of material, haven't we? So what's the key takeaway here? Well, I hope you've understood by now that by understanding what lies at the root cause of your problem, you can begin to effectively address it. There's absolutely no doubt in my mind that you too can become 100% pain-free no matter how long you've been suffering from RSI. The point is, life can change quickly. Not too long ago, I was still in pain, wondering if I'd ever be able to become pain-free again. And I was worried about my job and my future. But it's really amazing what knowledge implemented in the right way and at the right time can do to improve your life. Since addressing the two root causes of my RSI, as well as a few key sustaining factors, I've been 100% pain-free since September 2019. And I cannot begin to tell you how life-changing becoming finally pain-free has been. I can finally enjoy working and doing daily activities without stress and frustration, and I've become healthier and more productive than ever. My journey certainly hasn't been easy though, and it's only been by putting in hundreds of hours of research and through trial and error and interviews with dozens of people suffering from RSI that I was able to finally zero in on what exactly works. So listen, if you've experienced even just 1/10 of what I've gone through, then I think there's something that could be of really great value for you. I call it the Finally Pain-Free program. So it's basically what I've worked on intensively during more than 2 years of my life, at a time when I was searching for all possible answers to address the root cause of problems such as carpal tunnel syndrome, tendinitis, peripheral neuropathy, and other types of RSI. I pored over the scientific literature, I read dozens of books, and I personally tried and tested more than a dozen methods. I also spoke to lots of people just like you, people who had been suffering in pain, silently, and unnecessarily for way too long. And what all of this research and work did is that it allowed me to finally find proven solutions that can provide fast and permanent relief of RSI symptoms. The reason I've put this program together is because nobody had produced anything even remotely similar. Nobody had put these proven methods together into a simple, easy to use, and comprehensive program. And because I know exactly how you feel, and I've been in your shoes for many years, I wanted to make it as easy for you as possible to take control back of your own health and to get rid of your pain through a proven and guaranteed system. So I've put together this comprehensive program so that you can avoid a single more day spent in pain and frustration. Now, let me make this clear. This program is not for everyone. It's definitely not for you if you're looking for quick, short-term magical solutions. Now, I would love to tell you that you can become 100% pain-free in under a few days, but anyone who tells you this is probably lying. Things take a bit of time, sometimes they take longer, and that's fine. You will see progress quickly, but if you have unrealistic expectations and you're looking for a magical solution or a magical pill, you're probably better off taking painkillers or getting some surgery. Now, this program is also not for you if you're unwilling to invest some time and effort to regain your health, or you never implement what you learn. If you're not coming here to implement what I'm going to teach you, then I don't think this program is going to be able to serve you. But if you're willing to learn and to implement and to do the effort that's required to become pain-free, then this program might be the right fit. So here's what the program is all about. In a nutshell, the Finally Pain-Free program is a staged approach to getting rid of your postural imbalances, strengthening atrophied muscles, regaining mobility, getting rid of contraction knots in your muscles, which are called trigger points and which can cause a lot of lingering pain. It's also about using proper form and equipment when working on your computer, addressing the non-structural cause of your pain, and much more. Now, these are really the basic building blocks, but there's a lot more we cover in the program, and I'll give you a quick overview in a moment. But the point is that all of this is part of a proven system that's designed to reduce your pain through simple, evidence-based methods without surgery, drugs, or expensive therapy. Now, the program is structured in a way that makes it really easy for you to first identify and then address the root cause of your pain, and also attack factors that are known to sustain the pain. This way you really get all angles covered, and you can become anywhere between 50 to 100 pain-free in under a month. And we cover all of this in 4 simple but comprehensive modules. These modules and the introductory and concluding chapters include a total of 32 video lessons, or a total of 5 hours of high-quality content that you can access on the cloud from your phone, tablet, or computer anytime and anywhere. And the best thing is you can go through the program starting today and implement all of the proven techniques and exercises right away. And we also have, of course, some exercise sheets that go along with the modules. Now, this program contains literally every relevant and actionable piece of information that I've learned over more than 2 years of research and trial and error about RSI, and you will not find anything like it anywhere else. Now, if you've tried a lot of different things in the past, you know just how much of a financial burden RSI can become. Popular voice recognition software such as Dragon can easily cost $350 or more. Ergonomic gadgets, including specialized keyboards, can also cost several $100s. And in the US, the cost of a carpal tunnel surgery ranges from $2,000 to $4,000 or more. And we're not even factoring in the lost wages and lost productivity associated with all of these temporary solutions that address the symptoms rather than the cause of your problem. So in comparison, the Finally Pain-Free program requires a relatively small investment of $97. That's designed to give you results as soon as possible, and it focuses on proven, evidence-based solutions that work and that can get you real permanent relief of your symptoms. My goal is not only to address the root cause of your pain, but it's also to stop you from wasting your time and money on stuff that just doesn't work, like I did for 2 years. One more thing. Once you've paid for the program, you'll have access to it forever. You won't have to spend another dime on expensive therapies and painkillers. And best of all, you won't have to spend another day depressed, frustrated, and out of work. So before we end this video, I'll briefly walk you through the 4 modules covered as part of this program. In Module 1 of the Finally Pain-Free program, we have a detailed discussion of what exactly is a repetitive strain injury and the various conditions that typically fall under the broad label. We briefly talked about this here in this mini course, but we have a much more detailed discussion. We then take a bird's eye view of a number of key evidence-based methods or theories that explain what causes, triggers, and sustains RSI symptoms. I'll also discuss expectations and a few key things to keep in mind to get the most out of the program. In Module 2, we look at the structural or physical factors that lie at the root cause of your RSI and why conventional treatments of pain tend to fail. We then cover a proven postural therapy program in detail, including 13 short exercises that you can do at home every day. We also discuss 11 specific strength training exercises that can help you to significantly reduce RSI symptoms, especially when done in combination with the postural therapy program. In fact, that's what I've used to reduce my pain symptoms by up to 90% in the space of 2 weeks. And we cover in detail key training principles and how to put in place a safe and effective training program. In Module 3, we discuss non-structural factors that could lie at the root cause of your RSI. This is a very important module, and I would urge you to view it in full and to make an effort to understand all of the concepts introduced throughout the videos. So we begin with a detailed discussion of a number of facts that doctors cannot explain about RSI, and we examine why the RSI chronic pain epidemic has only gotten worse in the past 3 decades. More importantly, we take a deep dive into a proven, clinically tested method to get rid of RSI. It's a method that's been practiced by licensed physicians for over 30 years, and it's what I use to permanently get rid of my residual pain that I felt and that just wouldn't go away. Physicians from a number of highly reputable institutions have used this method very successfully to treat thousands of people just like you and I. We finished the module by introducing a simple 3-step approach to getting rid of your RSI. In Module 4, we talk about several factors that are known to sustain RSI symptoms. These factors include ergonomics, which I'm sure you've heard about before, but you might be surprised to hear that it's probably less important than you think to get rid of your RSI. We'll also discuss the conditioning of pain and recent scientific research that's shown that pain sensations can be conditioned by your central nervous system. We've discussed this contributing factor earlier in this video, so you should already be familiar with this. Next, we discuss another important topic, which is trigger points and how you can get rid of these painful little knots that form in your muscles and that can sustain pain in your arms, wrists, or hands long after any actual problem is gone. We then turn our attention to talking about deficiencies of essential vitamins and minerals, which many doctors believe can be a contributing factor in sustaining RSI. And finally, towards the end of Module 4, we cover a number of additional treatments and tools that can get you great results. This includes a 3-minute treatment used by elite athletes to safely and naturally reduce the body's inflammation and pain. All of these are meant to be complementary to the methods covered in the previous modules. Alright, that concludes our overview of the Finally Pain-Free program. There's quite a lot to cover, isn't it? So once again, simply click on the link in the video description below. This will take you to the Finally Pain-Free program page where you can easily register and get access to the program right away. As a reminder, the program requires a small investment of $97. This will give you lifetime access to the 32 videos and 5 exercise sheets that come with the program. Best of all, you won't have to spend another $1 on painkillers, cortisone shots, expensive physiotherapy sessions, ergonomic gadgets, or even surgery. Alright folks, this concludes this mini course. I thank you so much for watching all the way. I really do appreciate it. More than anything, I really hope that this mini course has been well worth your time and has provided you with a lot of useful information. I hope you now feel much more confident about how you can deal with your condition and become pain-free again. And more than anything, please stay optimistic. I have absolutely no doubt that you can and will become 100% pain-free. Click the link in the video description below and I'll see you on the other side. Talk to you again in a bit.